Hi, I'm Dr. Deva Boone of the Southwest Parathyroid Center. What is secondary hyperparathyroidism? When I talk about parathyroid disease, what I'm often talking about is primary hyperparathyroidism, which sounds similar but is a very different disease. So I want to get into or explain what secondary hyperparathyroidism so we can distinguish these two. With primary hyperparathyroidism, remember, it's usually a problem of the parathyroid glands. Most often, it's a benign tumor of one of the parathyroids, and that benign tumor is overactive, making too much hormone, and you end up usually with high calcium levels. With secondary hyperparathyroidism, you also get overactive parathyroid glands, but the difference is that they're overactive because they are trying to do their jobs. So parathyroid glands, remember, they exist in order to regulate your calcium. They are trying to keep your calcium level in normal range. And to do that, they make parathyroid hormone. If your calcium level is low, your parathyroid glands make more hormone. If your calcium level is low and your parathyroid glands can't get the calcium up for whatever reason, then they're just going to keep making more hormone and more hormone until you have a high PTH level. And over time, the glands can actually even grow. Just like using a muscle, if your parathyroid glands are working too hard, they will grow over time. So you can get all four glands getting enlarged or hyperplasia. This happens because the parathyroid glands are trying to do their job. Remember, with primary hyperparathyroidism, they're not doing their job. They're overworked. They're overworking their job. They're doing too much, but it's inappropriate because the calcium level is too high and the parathyroid glands should turn off, and they're not turning off. That's primary hyperparathyroidism. With secondary, they're not turning off because they still need to be on to try to get your calcium level up. So big difference here. With secondary, the glands are trying to get your calcium up and they're just having to work too hard, and for whatever reason it's not working, so they just keep making more hormone. Now there's a few different causes of secondary hyperparathyroidism. A lot of times secondary hyperparathyroidism is due to malabsorption, meaning for whatever reason, your intestines are not absorbing the calcium that you're getting from your diet or from supplements. So a common scenario is patients who have had a gastric bypass. When you have a gastric bypass, the intestines actually bypass the duodenum, and that is where the most active absorption of calcium occurs. So as a result of that, you will have a hard time getting enough calcium lifelong from your diet. And everybody after a gastric bypass has to take some calcium supplementation, or you will develop secondary hyperparathyroidism because your parathyroid glands are going to have to work hard for you to get enough calcium and keep your blood calcium level in a normal range. And a lot of times after a gastric bypass, your calcium level will tend to kind of stay on the lower end of normal. And if it drops into that low range, that is going to chronically stimulate the parathyroid glands. Another things I see, another cause of malabsorption is chronic diarrhea. This could be due to any cause. Could be Crohn's disease, could be celiac. Any reason that you have chronic diarrhea, that will lead to or can lead to secondary hyperparathyroidism because your intestines don't have time to absorb the calcium because things are just going through too quickly. So your blood calcium level will be low. The parathyroid glands make more hormone in response. Other causes of malabsorption include vitamin D deficiency. So if you have a real vitamin D deficiency, your intestines will have trouble absorbing enough calcium. Remember that active vitamin D, one of the major roles for activated vitamin D is actually to help the intestines absorb calcium. So without vitamin D, it may be hard to get enough calcium in. Another cause is simply not getting enough calcium in your diet. So if you are vegan or you have a very restrictive diet, you may not be getting enough calcium. And if you don't take supplements, you may develop secondary hyperparathyroidism. Okay. Another cause of secondary hyperparathyroidism is kidney disease. This is typically pretty severe kidney disease. So we're talking about end-stage renal disease where you're close to dialysis or you're on dialysis. Patients who are on dialysis pretty much invariably get secondary hyperparathyroidism to some degree. Because their kidneys then can't activate the vitamin D, They tend to have low calcium levels. They tend to have high phosphorus levels. All of this stimulates the parathyroid glands, and they get very, very high PTH levels when you're on dialysis. So you can see PTH levels up into the thousands. Another form of secondary hyperparathyroidism that is a little bit less common, that doctors often don't think about, is something called renal calcium leak. This is actually a problem involving the kidneys, but it's not chronic kidney disease. So your kidneys may work just fine, they may function normally, but in this condition, they release a little bit too much calcium into the urine. That causes the urine calcium to go up, and it causes the blood calcium to drop, which then stimulates the parathyroid glands to make more hormone to try to get that calcium back up. All right, so these are different ways in which you can get secondary hyperparathyroidism. But again, the key difference with this is your parathyroid glands in secondary hyperparathyroidism are doing their jobs. They're doing exactly what they're supposed to do. It's just not working, or not working as well as it could. And so they're having to keep making more and more hormone to try to get that calcium into the normal range. With primary hyperparathyroidism, the big difference is that most people are going to have high calcium levels with it. And if you have a high calcium, you can't have secondary hyperparathyroidism. So if your calcium level's high, you don't have secondary hyperparathyroidism. It's something else, usually primary hyperparathyroidism. If your calcium levels are low or on the lower end of normal and your PTH is high, typically that is secondary hyperparathyroidism. Now, there is something called normocalcemic primary hyperparathyroidism, where you can have normal calcium levels and have primary hyperparathyroidism, but that's a more advanced topic, and we will get to that later. Just note in general, most cases of primary and secondary are pretty clear. They're usually it's usually not so hard to distinguish them. So low calcium levels with high PTH levels, that is secondary hyperparathyroidism. Parathyroid glands working hard to get the calcium up. Calcium level is high, and the PTH is either normal or high. That's parathyroid glands are not responding appropriately to high calcium, and that is primary hyperparathyroidism. Okay, I hope you understand the differences now.